Motivational interviewing is a collaborative, goal-oriented style of communication with particular attention to the language of change. It is designed to strengthen personal motivation for and commitment to a specific goal by eliciting and exploring the person's own reasons for change within an atmosphere of acceptance and compassion. Motivational interviewing uses a guiding style of communication that falls between good listening and directing. It was designed to empower people to change by helping them to see their own rationale, importance, and capacity for change. This interviewing technique is based on respect, embracing a curious and compassionate way of engaging with people that supports the natural process of change while honoring individual autonomy. Motivational interviewing is built on a 4-step process that occur to some degree linearly, but not always in the same conversation. As you start to engage the individual, you are listening to their information without judgment and reflecting back what they shared for clarity. This will lead to helping them focus on the main issue, situation, and goals. What matters to them, what motivates them. As the conversation continues, you want to evoke the person's internal motivation for change. Identify discrepancies or gaps between their valued and current behavior or position. This will lead to helping them envision a plan for change and work towards some commitment, however small. In this scenario, Danny, an LPN, has expressed concerns about the risk of the updated COVID vaccine. The HR department has asked her to meet with the director of nursing to discuss the risk and benefits of the COVID vaccine. Jane, the director of nursing, integrates motivational interviewing into the discussion to learn more about Danny's concerns. Hi, Jane. HR suggested I talk to you about the COVID vaccine.
Sure, Danny. I have a few minutes right now. Tell me what's going on.
I know they want us to get the updated COVID vaccine, but I got sick last time I got the shot, and I still got COVID later when there was an outbreak. I don't think I want to deal with that again. It caused me to miss work, and I can't afford to miss the pay right now.
I can see how that last experience made you a bit wary. I want to be sure I understand. You had the vaccine in the past, felt sick afterward, and missed work. Missing work really worries you?
Yeah, I left work early because I felt fevered and had a headache the day of the shot and missed work the next day.
Yes, mild fevers, chills, sometimes arm discomfort at the site of the shot, those are normal side effects. The vaccine gives your immune system a workout, so your body is ready to fight off the virus later. Did you take anything to help you with the symptoms?
No, I didn't. Maybe I should have.
That probably could have helped. And if your goal is to stay healthy and avoid missing work, it's best you talk to your primary care doctor about what is safe to take to reduce side effects if you develop them.
The other problem is I still got sick with COVID and had to miss work then. Why take the vaccine and risk it? I don't think COVID is that bad.
I see your dilemma. You want to stay healthy and not miss work. Some people do get mild symptoms if they get COVID, but others, even healthy people, can get really sick or have long-lasting fatigue and breathing problems. Can I share what we're seeing now about the vaccine's benefits?
Sure.
The updated vaccines are built to protect against newer versions of the virus. You're right. You can still get COVID after being vaccinated, but the difference is how sick you get. Vaccinated people are much less likely to be hospitalized or to get long COVID, which can keep people out of work for weeks.
Some people online say the vaccine can cause more harm than good, like it wasn't tested enough.
I've heard that too, and I'm glad you brought it up instead of just wondering. These vaccines went through full safety testing before being used, and they're still being closely monitored. Millions of healthcare workers and residents have safely gotten them. Most side effects are mild and short-term, while the risks of COVID itself, like heart or lung problems, are much higher.
I guess that makes sense. I wouldn't want to risk my family or the residents getting sick either. Will getting the vaccine be a risk to them?
You're thinking about others, and that's important. The vaccine actually helps protect your family and residents. After vaccination, you're less likely to spread the virus if you do get exposed. So, by getting vaccinated, you're reducing the chances of passing it along to those who could get very sick. And if you ever see something online or hear something that sounds confusing or scary, bring it up, and we can go over what's true and what's not together. The CDC and our state health department have good, up-to-date information if you ever want to check something out for yourself.
I want to protect my family and not miss work. I'll call my doctor on my break and see what they suggest I could use if I get side effects again. In the meantime, is it okay if I wait a few days?
Of course. Take some time to think about what we discussed and plan your timing. Maybe getting the shot before your days off would help you manage any short-term side effects more easily.
Thanks, Jane. I appreciate your taking the time to explain this.
You're welcome, Danny, and thank you for asking the tough questions. That's how we make the best decisions for ourselves and our residents.